Are you currently taking a statin or are you thinking about taking a statin? Here's some interesting information on the effectiveness and some of the side effects that you might want to talk to your doctor about. Hi, I'm Keith. For those of you who don't know me, I am a 7-year cancer survivor. I've studied over 4,000 clinical papers on the root cause of all chronic diseases. Environment, lifestyle, it's called epigenetics. I've reversed all 5 of my chronic diseases, and I know you can make great progress too. If you want some help, DM, get on my calendar, and let's talk. Ready? Let's dive in. A lot of the side effects of statins are pretty well known, like muscle pain or weakness, headaches, digestive issues, fatigue. But did you know that there's a chance of liver problems, kidney problems, and now a lot of new research coming out about how it dramatically can increase the risk of type 2 diabetes. And of course, once you've started down the medication path, it's highly likely that your doctor's going to want to put you on other medications to deal with those side effects. So make sure that your diagnosis first is accurate. Mayo Clinic did a study, 88% of the people that came in there for a second opinion, the first opinion was incorrect, and that's just not acceptable. So here are some of the things you might want to think about before taking a statin, or maybe if you are taking a statin. You want to know your ApoB score. That evaluates how many of the small, dense particles you have in relation to all of them. If that number is small, you might not need a statin. If your ratio of triglycerides to HDL is low, you might not need a statin. And when it comes to the effectiveness of statins, this one's mind-boggling. A study was done on how much longer do you live if you're using a statin for prevention, primary prevention, or secondary prevention. Secondary prevention is if you've already had a heart event and you're trying to prevent a second one. If you're taking a statin to prevent a primary or a first event, that's going to extend your life 3 days. If you're taking a statin to prevent a second event, that's going to extend your life 4 days. So I ask you, is it worth it? Please get a second opinion and talk to another cardiologist and ask them some of these questions. If you like these videos, please like and follow.